Hi, hello, dear dudes and duties. I'm Dr. Adi, and it's time for your binge. You all know that the action of hormone insulin is to suppress the plasma glucose level. When we read about type 2 diabetes mellitus, always we come across a statement that it is a condition where both hyperglycemia will be there as well as hyperinsulinemia will be there. Hyperglycemia means increased plasma glucose level. Hyperinsulinemia means increased serum insulin level. Immediately there comes a question: how it is possible to have more amount of glucose when the insulin is very high? Because the action of the hormone insulin is ideally to suppress the glucose. How it is possible, and why this type 2 diabetes is also called as insulin independent or insulin resistant type? In order to make you understand, here comes a college student who is sweet like you. He is coming back to the hostel because he attended a lengthy lecture and want to take rest, the same way how you all will feel. So he approached his room. He found a big door with a lock hanging in it. If he wants to get inside the room, he have to take the key, he have to open the lock, then he have to open the door, after which he can be facilitated to enter inside the room. This hostel is having a peculiar feature that all the locks and keys are identical. That means any key can open any lock, or all the keys can open a single lock. So he took his key and tried opening the lock. He struggled so hard, but he could not able to do it. After seeing this, all his friends came to help him by taking their keys. Everyone tried to open the lock with the key. Unfortunately, they also could not open the lock. So as a result, all the students were gathered in front of the door in the corridor of the hostel, and all are having many keys in their hand. So there are many students and there are many keys. All are standing in front of the door. Then they found that the problem is not in the key, it is in the lock, because it got rusted within it. They all were confused and don't know what to do. Suddenly, there comes a legendary backbencher student with a oil can in his hand. He just came and he poured the oil in the lock. Immediately, when he tried with the key, the lock got opened. After which he can able to easily push through the door and he could facilitate himself inside the room. After which he took the rest and he was sleeping peacefully. Now let us relate this hostel story with the pathophysiology of type 2 diabetes mellitus, where you can observe both hyperglycemia as well as hyperinsulinemia simultaneously. Here our sweet student is going to be the glucose molecule, which always normally in ideal condition prefers to enter inside the cell, which is like the hostel room. This glucose takes the help of the key hormone insulin, which gets fit into the lock, which is like the insulin receptor, by which it gets triggered and opened up. This helps the glucose molecule to open up the door GLUT4, which facilitates the glucose to enter inside the cell, which is like the student entering inside the room. Now, in type 2 diabetes mellitus, the glucose molecule wants to enter inside the cell. So it will come and stand in front of the door and takes the help of insulin. But the key insulin could not able to get fit inside the lock receptor. Because of this, additional glucose molecule also tends to accumulate in the bloodstream, like how the friends of the student accumulated in the corridor of the hostel. as the glucose molecules keep on accumulating, it will trigger the production of insulin from the pancreas. So this key insulin also comes and help the glucose molecule to fit inside the locked insulin receptor. But this also is not going to help the glucose to enter inside the cell, because the problem here is the insulin receptor, like the rusted lock. So as a result, more glucose molecule will be standing to find a way to enter inside the cell, and in addition to that, lot of insulin molecules will also get accumulated. This leads to hyperglycemia and hyperinsulinemia in type 2 diabetes mellitus. Now, our legendary backbencher who came with the oil can now became a great doctor, and he wants to find a solution for this. So he gives the patient oral hypoglycemic drugs instead of oil can. This helps to sensitize the insulin receptor, like pouring the oil in the rusted lock, by which the insulin can easily fit inside its receptor and it will get opened up. This allows the opening of the GLUT4, which is nothing but glucose transporter 4, through which the glucose can easily facilitate itself into the cell, after which it can be utilized for glycolysis and other metabolic pathways. Even though lot of glucose transporters are there, only GLUT4 is insulin dependent. Even though the insulin levels are very high, still it is not helping the receptor to get activated. That's why it is called as insulin resistant type of diabetes mellitus. Let's have a look at this MCQ. A 56-year-old male is having polyuria, polydipsia and non-healing ulcer in his left foot. His fasting blood glucose level is 200 mg per deciliter, and fasting insulin level is more than the normal reference interval. What could be his probable diagnosis? 4 options are given: insulin dependent type of diabetes mellitus, diabetes mellitus type 1, insulin resistant type of diabetes mellitus, and gestational diabetes mellitus. It is insulin resistant type of diabetes mellitus. As we have discussed, here we could able to see both the plasma glucose level as well as the insulin level are very high, which is observed in type 2 diabetes mellitus, which is otherwise called as insulin resistant or insulin independent type. Now let's look at this reasoning out question. Why glucose level is very high despite of having high insulin level in case of type 2 diabetes mellitus? As we have discussed in the video, type 2 diabetes mellitus is occurring because of the problem in the insulin receptor. As a result, even though there is more insulin, they could not able to trigger the receptor to promote its downstream pathway. The GLUT4 will not come to the surface and the doors of GLUT4 cannot be opened. So the glucose tends to remain in the blood itself instead of going into the cell. Hope this was useful. Like, share and subscribe the channel so that my efforts can reach you.